Hello, everybody. Good afternoon, and welcome once again to a weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer. Welcome to this presentation. And joining us today is also Dr. Earl Stoddard, who is the Assistant Chief Administrative Officer, and Dr. James Bridgers, who is the Acting Health Officer. Reporters, members of the media, you should have already permission to record. If you do not, please utilize the chat to request it, as well as use the chat for the Q&A portion of this presentation, identifying the organization you work for. And with that, I toss it to you, Mr. County Executive. Good afternoon.
Good afternoon, and welcome to December. And I think it was snow flurries I was greeted by yesterday. So things are changing. Thanks for joining us for our weekly press briefing. To start with, today is World AIDS Day. Before we begin our COVID briefing, I just wanted to quickly note that, and that it's both World AIDS Day and Rosa Parks Day. This morning, I attended a World AIDS Day Solidarity Breakfast at the Viz Arts Gallery up here in Rockville. This event supports our implementation of Montgomery County's plan to end HIV. It was a wonderful event, and I joined many in attendance and got tested for HIV, negative. This evening, the HIV and STI Services Division of our Health and Human Services Department is hosting a Reflection and Resilience Vigil and open house at the Dennis Avenue Health Center in Silver Spring. The open house is from 5 to 7 p.m. and it'll begin with an outdoor candlelight vigil to honor and memorialize those who've passed away from complications of HIV/AIDS and COVID-19. Attendees will be able to tour the county's HIV and STI clinics and meet clinical staff and community partners, get tested for HIV, view Montgomery County specific sections of the AIDS Memorial Quilt, and enjoy light refreshments. Montgomery County's home to NIH and many incredible biotech companies that are working on HIV and AIDS cures and treatments. And we are, as always, an inclusionary and compassionate community. We're well aware that even in AIDS, there are disparities. We've had a lot to celebrate in terms of progress made in combating AIDS and HIV over the past 40 years, but we still have many who are dealing with the physical, mental, and financial health impacts of contracting this virus. So while we've done much, there's still much left to do. But there are some promising things on the horizon, and hopefully we'll all be seeing even better days in the near future. Today's also Rosa Parks Day. This morning I proclaimed December 1st as Rosa Parks Day in Montgomery County, recognizing Rosa Parks' heroic refusal to give up her seat to a white man on a Montgomery, Alabama bus on Thursday, December 1st, 1955. This courageous act helped galvanize the civil rights movement and triggered the Montgomery, Alabama bus boycott that lasted 381 days. Montgomery County understands the strong correlation between accessibility and race, and we're committed to supporting communities that have been disadvantaged by racism by improving transportation, providing safe environments, walking, bicycling, to ensure easy and safe access to education and employment opportunities. And we do evaluate our services and messaging through an equity lens. To mark the occasion of this historic anniversary, we've installed a placard on each Montgomery County operated bus that states, quote, dedicated to the memory of Rosa Parks on December 1st, 1955. Rosa Parks took a seat on a bus in Montgomery, Alabama, and changed the course of American history. These placards were made on every bus in a visible location to passengers throughout the month of December. I will say that while what Rosa Parks did indeed changed the course of American history, unfortunately, in the time we're in now, we're facing people who are trying to reverse the course of American history. Her action and the Montgomery bus boycott were seen as catalysts for a more progressive and more determined civil rights movement, culminated in important legislation in the 1960s, the end of restrictions on deeds that prevented people from living in certain neighborhoods, and the beginning of a general opening up of rights to everybody in this country. And so it's regrettable to note that at the same time we're celebrating Rosa Parks Month, that there are states and there are the Republican members of the US Congress who are busy trying to whittle away the voting rights of African-American residents. It is embarrassing, shameful, and deeply disturbing that on a day when we're celebrating the achievement and the effort to move the civil rights movement forward and all the things, good things that happened at it, things that I grew up with and knew were going to be, had the potential to change the direction of society, that now we have to refight these battles and try to re-protect people who should, by the mere right of being American citizens, have unfettered access to the ability to vote. So I just want to note that there's a celebration element of this, but there's an irony element of this day. And we need to restore this country to a path that involves greater civil rights for our residents, not fewer. Now I'm going to pivot back to our COVID update for this week. Our test positivity rate was 2.8%, and we have a case rate of 10.92 per 100,000 residents. We had 120 cases yesterday, including 4 hospitalizations and 1 death. As you can see from the map, Montgomery County is in the orange zone. Prince George's County is now below us. They've been below us for a little while now. I will point out that unlike Montgomery County, Prince George's County kept its mask mandate. I think you're seeing the effect of being willing to keep the mask mandate. And Prince George's County recently decided to extend that mask mandate to nearly the end of January. I'm hoping that our Board of Health makes a similar decision. We need to stop bouncing back and forth and focusing, are we over or under 50? And just recognize that, in the current stage of things, this virus is still out there. It's still infectious. People are still getting sick and dying, and that masks are our best protection to keeping people safe. And I think, the data kind of bears that out. In terms of testing, we're expecting to see an increase in our testing volume this week, as many who enjoyed Thanksgiving gatherings are doing the smart and prudent thing, which is going to get tested to ensure they're still COVID-free. I want to thank the state for providing 10,000 take-home rapid test kits. Each kit contains 2 tests, and we also got an additional 8,800 test kits that'll be used by HHS and other partners. We'll be providing these kits to minority health initiatives, community partners, and we're reaching out to the restaurant and building trade industries to provide them to frontline workers going into the upcoming holidays. And quite frankly, our path forward is going to be determined by how well we can vaccinate, test, contain, and mitigate this virus. I think it's a drill that we're all familiar with, but it's just a reminder that we're still in the process of trying to contain and mitigate the virus in our community. Additionally, increases in access to rapid tests will be critical to effective use of the new therapeutic pills, as they require early administration to be effective. The FDA panel yesterday approved the Merck pill, which is about 30% effective in reducing severe illness. Pfizer's pill, which is yet to be approved, may prove to be even more effective. I hope to see it get its approval before the end of the year. These are both great news. And the pills may provide an effective treatment, but it depends on detecting the infection early, which re-emphasizes how important testing will continue to be in the county. If you don't get tested and detected early, these pills do not have the same effect than if you're detected early. So testing is going to continue to be important. You can see in the chart the vaccinations in Montgomery County. We are back to 92.5% of the total population, pretty close to 80% being fully vaccinated. The over 12 population, as you can see, is 99% with 1 dose and about 93% with 2 doses. And the over 18 population is 99%, almost 100% with 1 dose and 93% with 2 doses. and the seniors 65 and older are virtually all vaccinated pretty much. We continue now to try to drive the booster shots and make sure that people are getting these boosters. We're likely to be over 80% of our population fully vaccinated this week, and that's going to be a big deal. We're the first in the state, the region, and among very few jurisdictions throughout the nation that have been able to get to 80% fully vaccinated. And to put this in context, Howard County, who's done very well at vaccinating their residents, is second to us at about 76% of their population vaccinated. We're also up to over 202,000 booster shots provided. Although this is the most in the state, we'd still like to see more people go and get their booster shots, particularly since we have this unknown entity, the Omicron virus version of the COVID virus, possibly around the corner. And it's important to do this, especially over the holidays, because the combination of cold weather and holiday celebrations is likely to bring an awful lot of people in close contact with each other. Every eligible adult who received their 2 doses of Moderna or Pfizer more than 6 months ago, or Johnson & Johnson 2 months ago, should immediately seek a booster. They're available. Please come get the boosters. We don't have a supply problem right now. Boosters are available at pharmacies and through other private providers, and they're also available at county-operated clinics as well, and along with our partner clinics. Our HHS department is currently working on advertising and marketing campaigns for us to encourage more residents to get their booster shots. And again, with Omicron virus looming, boosters are going to continue to be probably more important than ever. We continue to vaccinate our 5 to 11-year-olds. We're currently 1/3 of the way through this population. As we said in past weeks, we'd still like to see our allocated doses from the state come to our HHS department. As you can see from the chart, our HHS department is allocating 42% of the doses as compared to other providers in the county, but we're only receiving 1/3 of the shipment. So we're outperforming everybody else, and we can get doses into the arms of people who need them faster than anybody else can. So we're hoping that the state will recognize our ability to get this done and provide more doses directly to our county health department. I've mentioned the name Omicron a couple of times. So, the Omicron variant of coronavirus has been found in 20 countries so far, not in our country yet, but it's inevitable that it will arrive here. This is very similar to the first arrival of the Delta variant. Delta was first detected in India at the end of last year. It was not named Delta until May of this year and began really taking its toll on our country by midsummer. And we hope we can get through the holidays without experiencing what happened here last summer, where our cases, after dropping seemingly pretty close to nothing, spiked up again and have stayed at higher levels since then. There were days in the early summer when we were looking at 4 or 5 cases a day. Yesterday's report was 120 cases. The day before, I think, was 140 cases. So those days of this thing not being around very much are no longer here. And we have a fair number of people who are still getting sick, which means they're carrying it. We need to be very clear that just like Delta, which was different than the original COVID virus, Omicron is not Delta. It's also different. It has a mutational profile that's very different from the other variants. It has a large number of mutations, some of which are concerning to the experts. Preliminary suggests an increased risk of reinfection and a more rapid spread. So we still don't have enough data to make definitive statements about what this is going to be. We don't know how it's affecting patients who do get sick. So we're not, we don't anticipate at this moment that we're going to do anything other than be very vigilant about this and encourage everybody to get boosted. The vaccine manufacturers believe that the booster will retain some efficacy against the new variant. And with that in mind, we do encourage people to go out and get tested. The vaccine manufacturing companies have, at least the couple that I've read about, have said they should be able to develop vaccines for the new strain that could be out in the market within 100 days or less. So there's progress being made. We're able to respond a whole lot faster than we were earlier in this process. So, I think there's reason to think that we've got more hope for being able to control this, but it's still a problem, and we still need to be smart about this and be careful about what we do. I've said this, for a long time. We've focused on keeping things open in Montgomery County. We believe we're at the point that with a low enough number of cases and with people taking the right precautions, that we can sustain, at least at this point, keeping things open. We don't want to lose that. And that's why, getting vaccinated and frankly, wearing masks, I think, continues to be really important. We want you all to be safe. We want you to enjoy this holiday season. And we don't want to see this virus getting out of containment and being a bigger problem than it otherwise might be. We're going to know a lot more over the next 2 or 3 weeks, so stay tuned. We'll certainly keep you updated as we get the information from the medical professionals who are working on this. So we're not suggesting that Omicron should cause a panic at this point. I've directed I've directed our staff to look at our personal protective equipment inventories in case there is another surge. As I have mentioned over the past 2 weeks, we need more doses to vaccinate the 5 to 11-year-olds as quickly as possible. And again, we're better prepared and to some degree less vulnerable than we were during earlier surges if the vaccine continues to retain some of its ability to moderate the severity of infections. So stay tuned. We'll be back again next week. We'll let you know where we stand then. And if there's any breaking news between now and then, we will join with the other efforts to reach out to our communities and let you know where we're sitting. In non-COVID news, I had a busy week engaging with businesses large and small. For Small Business Saturday, I stopped by several small family-owned as well as minority-owned minority and women-owned businesses. I not only enjoyed shopping for holiday gifts and keeping my money in this county, but I also listened and talked to the owners and employees in their stores and talked a lot about how tough it's been the last 22 months. I think this picture is, one of these pictures is me sitting in Levin's acoustic guitar room up in Wheaton. For those who don't know me, I think I bought my first electric guitar from Levin's down when it was in DC around 1963, 64. These folks have been in this community a long time. And I noted then, and I just want to note again, that they do own other commercial property. And one of the things that I discovered earlier during COVID when I was talking to some of the small businesses, that they had done pretty well by helping their small businesses weather the lack of income, particularly during those hardest, first months when we were really seriously closed and people weren't able to make money because nobody was allowed to go into their stores. And I really appreciated the work that the family put into working with the small businesses who were their tenants. It helped a lot of people survive. I also went over to Gwenny's bakery, was one of my other stops, and this is a nice little bakery shop up in the Rockville area, and it was really nice. They've expanded. They were incredibly busy, and it's good to see people thriving. And all of the businesses were looking forward to recovery and moving beyond where they'd been in the summer. So it's good to see this happening. On Monday, I was able to join Councilmember Glass along with Delegate Wilkins, Charcutean, and Moon to announce $231,000 in state funds that will be distributed as grants for businesses affected by the Purple Line construction. At this event, I talked to several of these small business owners that have been severely impacted. And these grants are going to help some of them, but it's really limited in the number of businesses that'll be able to be served by the $231,000. And there are many more who are desperately in need. We were in Silver Spring, in a location where they've closed half the road, taken away all the parking. It's one way only. And so the parking that normally would have served these businesses is gone. There's not a lot of surface parking close by. So they are being impacted, and there are many more businesses. We are going to keep fighting for more money for the Purple Line. There's a bill that provided Bill 114, which could mean more support for small businesses. It had $2 million in it that would have been provided $1 million each in funding for FY23 and FY24. That bill was vetoed by the governor. Inexplicable for a person who makes a lot about his support for small businesses and business in general, that he'd veto aid bill for people who are being unable to serve their customers because of the construction of the Purple Line, but he vetoed it anyway. We're optimistic that the state legislature, when they come back next into special session next week, will override the veto, and that would make this money available to businesses in Montgomery and Prince George's County. And again, if you're in those areas where you have these small businesses located along Purple Line routes, I'm sure they'll appreciate your business if you happen to stop by. Also on Monday, I was pleased to join representatives from Boston Properties, the Bernstein Companies, Rand, as well as the team from Marriott to take a tour of the new Marriott Headquarters being built in Bethesda and the hotel that's opening up next to it. This is a 785,000 square foot building. It's going to host more than 3,500 Marriott employees. It will be LEED Gold certified and has state-of-the-art technology throughout. It has many modern amenities, including a childcare center, a fitness center, and a cafeteria. And while Marriott considered dozens of options in the Maryland, DC, Virginia area, they chose to stay in Montgomery County, encouraged by the walkability and transit access and the host of amenities and in the Bethesda area. As I toured this building, I was impressed with the sustainable construction practices being used. But I think one of the most important things that we talked about there, I asked them whether they're heating this building with electricity or natural gas. And for those of you who are following the debates over climate change, one of the things that is believed we have to do is shift from gas heat to electric heat. And we're obviously not going to do this all at once, but it's something, that we're looking to require in new buildings and hoping to require when buildings need updating in the future. What was significant is they were starting their building with electric heat, and systems have become a lot more efficient. And I was encouraged to see them doing this. It's a big step forward, because heating that building would be would require an enormous consumption of natural gas, and being that it's electric, that's not going to be the case. We have legislation in front of the council that we sent to the council in the spring. We're still waiting for them to act on it. The council president hasn't seen fit to bring it forward until the last very short period of time. But this is the Building Energy Performance Standards legislation. And as we've tried to point out before, there is no reaching any of our climate goals if we cannot deal with the built environment. And in order to deal with the built environment, you need legislation that requires people to adopt more modern heating, cooling techniques, as well as taking other steps to make their buildings more efficient. So hopefully this bill will find its way through the council and we'll go into the process of implementing. From large corporations to small businesses, we're engaging, helping out, and providing resources once again. And our goal is to make Montgomery County the epicenter of economic activity. As we mentioned a few weeks ago, 76 Montgomery County companies received a record funding of over $18 billion in private investment during the first 3 quarters of this year. Finally, yesterday was Giving Tuesday, and I hope many of you used this day to give to their favorite charities and nonprofits. But supporting nonprofits is a year-round endeavor, and I encourage anyone with means to become sustaining donors as well as volunteer your time and energy. I see and appreciate the work of our charitable nonprofit community every day. I want to thank them for their hard work and our residents who support them. I don't know if everybody realizes how big a role the nonprofits played in the county's ability to bring relief directly into the community. They were partners who made a difference, and without them being there and able to provide their support, some of the work the county would have tried to undertake by itself would have been much more difficult and probably less effective. So they're really important. And when you're thinking about the nonprofits, many of these folks have major fundraisers. Usually it was a dinner in the winter or, some fundraising event that was in person, and, we'd all go out and contribute. And not being able to do that because of COVID has really put a damper on fundraising activities for many of these organizations. So they're in a different situation than they've been in other years, except for last year. So if you are thinking about it, if there's some organization that you think is doing really good work, go on the website and send them some money, help them out, because they need other ways of bringing in dollars until we go back to a more normal environment. And with that, I'm going to turn this over to Dr. Bridges and Dr. Stoddard for their updates, and I look forward to your questions.
Good afternoon, all. Just a couple of additional notes to the county executive's COVID update regarding our 5 to 11-year-old vaccination strategy. Share the slide here. And so we continue to deploy our equity framework. We continue to deploy our equity framework regarding our race and ethnicity. When we began for our 5 to 11-year-olds, we saw a wider gap between our Black, Hispanic, Asian American, Pacific Islander, and Native American population that reported as others. We are seeing that starting to lessen now as we continue to have the support of our Montgomery County Public School system partners and our minority health initiative partners and our community partners to get into those spaces and those communities where we have seen lower vaccination rates or individuals who are unvaccinated. As Mr. Elrich indicated, 3 weeks ago, we administered 61% of the 5 to 11-year-old pediatric doses, and that has decreased with the increase of our physicians' offices and pharmacies and community nonprofits. We continue to only receive a third of the vaccines that are being allocated to the county. Last week, we requested 20,000, and I think we received almost 13,000. Again, we requested 20,000 pediatric doses, and we haven't received word on the allocation. The team is checking on it now. In the county, we still lead the number of pediatric doses that have been administered in the state of Maryland at 34,012 first doses, and we continue to administer those doses as fast as we can and in partnership. This week, we have targeted 6,500 second doses, and so we will begin vaccinating, administering the first series of the 5 to 11-year-old doses in our attempt to get all of the 90 to 100,000 5 to 11-year-old vaccinated. I'll stop there. Happy to answer any questions.
Good afternoon. I'll just add a couple points. Number one, reminder on boosters. If you received your Pfizer or Moderna second dose before June 1st, you are eligible for a booster now. Please do come in and get your boosters. I got mine the Friday before Thanksgiving. And so I'm very much interested in seeing that number of 202,000 go up. My guess is there's probably 500,000 or more residents who are eligible for a booster at this point. So we've got several 100,000 people that should come in and get boosted before the end of year holidays. If you got a Johnson & Johnson dose as recently as September 30th, you're now eligible to get a booster as well. And so anything before September 30th, you're with Johnson & Johnson, you should come in as well. To echo what the county executive said, we're obviously closely monitoring the information with Omicron. I spend a lot of my day following, reading what some people who know a lot more about this than I do have to say about it. I think the universal statement from scientists who I trust and respect is that this called for some prudence, but not panic, as the county executive said. We'll know a lot more information over the next couple of weeks about the variant and what exactly its characteristics are. Obviously, we're paying a lot of attention to its transmissibility, its immune evasion characteristics, and its virulence, how sick it makes people. And I think those three factors in combination will tell us a lot about what we should expect the strain to do when it, obviously ultimately makes it to the United States. I think there's every reason to believe that there are probably already cases that have occurred or are currently occurring in the United States. We just haven't detected them yet. I think we're seeing that play out in Europe as well. And so while the United States does as much sequencing or more sequencing than anyone else in the country, it's still, you're looking through a lot of cases in the United States right now. And so finding that the first cases of Omicron will probably happen this week is my guess. We'll see it in the United States. And so we're preparing for that. And obviously, just checking the systems that we have in place to make sure that we're ready to go, encouraging people to get boosted, encouraging our 5 to 11-year-olds to get vaccinated, and making sure we have rapid tests and other capabilities in place to respond. And so I think that's sort of where we're at, and happy to take questions.
All right, thank you, gentlemen. Let's get started with the Q&A portion of this presentation. Randy Bass, you're up first. WDVM, good afternoon, Randy.
Good afternoon, everyone. Thanks for having me on the briefing again this week. Couple questions for officials. Are there any plans to change the 85% mask mandate threshold? I feel like the county executive may have alluded to that in some of his earlier remarks. Are there any plans to change that at this point?
Sure, Randy, I'll start. Currently, there are no plans to change that. Of course, we advise our county executive daily and our council sitting as the Board of Health regarding the numbers, not only the number of cases, test positivity, but the hospitalization rates and death. We have a very high vaccinated population, as Mr. Elrich indicated. Although once we see any upticks in the number, we will advise them accordingly. We've also done some projections regarding that threshold. We indicated that the 5 to 11-year-old vaccination strategy is going, but again, we can only administer those doses in arms, which would add to that achieving that 85% target as fast as we get those allocations. And so we anticipate, again, as other jurisdictions have begun to assess whether or not January would be a more practical target date. And so we are running the numbers with our epidemiology team and our county stat team just to see when a realistic change is needed, if any.
So I'll just add to that. I mean, you guys know how much I hate dates. I think you're familiar with this. It ought to be conditions that determine whether or not you're wearing masks or not dates. And I think Omicron's a perfect example of this. We don't know how virulent it is. We don't know whether it jumps vaccine barriers. We don't know whether you get mild cases or whether you get severe cases. There's a whole lot we don't know. If it turns out to be a variant that has, goes across more vaccine barriers or more people get sick, which means more cases in the community, an 85% mark of how many people are vaccinated would be irrelevant. It wouldn't have anything to do with whether you're safe or not. It all depends on what the virus itself is doing at that point. So I don't think, you may be able to do it at 85% and everything could be fine. We may get to the point where at 85% and Omicron is doing things that make it more challenging than the other version, then it wouldn't be fine. So I think, everybody's got to focus on at what point is it safe to do what activities and to act, carry out our lives in a certain way. There's nothing magical about that percent that tells you the world has changed. It just tells you how many people got a shot. I'm more concerned is how safe are the people that, that we're trying to help in this county, not how many of you have shots. It may be one indicator, but not the only indicator.
Thank you.
Oh, Lorna, may I ask one more quick question?
Yeah, go ahead.
Thank you. And thank you all for answering that question. When it comes to being fully vaccinated now with the addition of boosters and the CDC and FDA recommendation for pretty much everyone to go and get them at this point, are there any plans or does the county feel it's necessary to potentially change the definition of what it means to be fully vaccinated? A lot of people, myself, got their vaccine many, many months ago. in the immunities waning, at what point is someone not fully vaccinated anymore?
So Randy, thank you again for that question. I'll start, and I'm sure the county executive and Dr. Starter will chime in. Our goal continues to be to get all countyans vaccinated, be it the first series, be it the boosters or third shot, and even those individuals who are 5 to 11-year-old who haven't gotten vaccinated. We continue to receive the data and updates and guidance from the CDC and MDH to determine what is identified as fully vaccinated. But once you receive your first and second doses, 2 weeks later, you're fully vaccinated, and then you're looking at either boosters or a third shot if you are immunocompromised. And if additional doses or additional treatment modalities are forthcoming or are necessary, as Mr. Elrich indicated regarding the Omicron variant, by the way, none have been sequenced in the state of Maryland as of this afternoon at 1:17 p.m., according to the Maryland Department of Health and the information that I received. However, we will pass that information along, but the key is to get vaccinated. And if you're vaccinated, get a booster shot. And so that's the message.
Yeah, the only thing I would add is, and this is why it's a little bit more complicated. I'll just talk about the nuances. We're going to take our cues from the CDC and the state of Maryland, obviously, on this. We don't want to be on our own making definitions like this because they affect a lot of things. They affect, the Pcr Test policy. They affect, different jurisdictions have, we don't have a vaccine passport, but that would affect that. So I think these definitions do matter. And the key point about this is if someone just received their second shot a month ago, they're not eligible for a third shot for a period of time. So then suddenly now they become not fully vaccinated and can't become fully vaccinated. I think it gets a little bit messy when we start messing with the definitions. Now, eventually, I think 2 doses will no longer be viewed as sufficient, but there will have to be a amount of time lapsed between when third shots become available and when people can receive them in order to really meet that. I just wouldn't, probably 500,000 to 600,000 of our residents were vaccinated by June 1st and therefore are eligible at this point. That leaves, 300,000 to 400,000 people who are either not yet eligible, just became eligible, or more recently got vaccinated, who would, no longer be able to meet the definition of fully vaccinated, whether they wanted to or not. And so I think any decision to change the definition of fully vaccinated will be a much more nuanced and complicated conversation that we would want to have based on federal and state guidance.
Thank you very much.
Thank you, Randy. Up next, it's Dominique Maria Bonesi, WAMU. Good afternoon, Dominique.
Hi, thank you so much, Lorna. Hi, County Executive Elrich. I had a quick question regarding the hazard pay special appropriation from yesterday. There was a big discussion within the council. Some council members were saying that your administration doesn't have a clear definition of what an emergency is. How would you define an emergency for the county? And do you intend to put out additional policy or new policy on what an emergency, how an emergency is defined in the county?
So I didn't create the definitions of emergency. Emergency is very, vague may be the wrong word, but very broad and open to interpretation. And I do think that coming out of this, particularly since no one anticipated an emergency that could last as long as this one lasted, or things that could change the nature of the emergency in terms of how people might experience it while still being within the emergency, we should look at some of these things going forward. I think this has been an educational experience for all of us. Our biggest concern was not wanting to, the provision in the law for the emergency, which is not defined. It's not like the law says this is what an emergency is the problem was that with double pay being the effect of being in an emergency, we negotiated a lower rate because we didn't want to wind up in court and have a judge rule that your contract says double time and you're going to pay double time. That would have cost the county way, way more money than what we arrived at. So I would like more clarity. I think everybody would like more clarity, and happy to work with the council and others to move to a better point. And I think I'll let Earl talk a little bit more about this.
Yeah, Dominique, there's a couple different places that emergency declarations appear within county regulation or code. There's obviously the county code and charter itself. There's chapter 2 of the code where the definition of emergency is sort of defined from a countywide perspective, and the powers granted to the county executives are defined. Those powers are obviously pretty useless when it comes to COVID. They're things like prohibiting the sale of alcohol, prohibiting the sale of firearms and ammunition, things that would generally be not useful in a COVID situation. The other place that the term emergency is used is in the personnel regulations as it relates to both the hazard pay, but also anytime the county executive wants or needs to close county buildings and offices, for example, after a snowstorm. And in that circumstance, it's much more focused to the closure or suspension of county services and building access. Now, obviously, during COVID, it was a little bit different than a traditional snow-related closure, and so there is certainly some ambiguity, as the county executive alluded to, in the definition of emergency and whether it qualified in this specific circumstance. Because we didn't suspend services, we transitioned them to a more telework, work from home, remote activation, but we still were offering permits and doing things that during a normal snow closure, we would actually suspend for that day over the course of the pandemic. And so obviously the definition of emergency is did not foresee and in most places does not foresee a 22 plus month pandemic in its definitions. And so we do need to go back and take a look at this because, number one, the enumerated powers in chapter 2 of the code do nothing to address a pandemic. And in the personnel regulations, they don't envision a prolonged period of alternate service delivery that doesn't necessarily equal to a closure. Now, the problem that this creates is the county executive is left in the position of trying to predict not just what he needs to do to respond to the emergency, but also what an arbitrator is likely to decide after the fact. And so there were really 3 different ways the county executive could have gone during this event. He could have declared an emergency, offered double pay provision to all employees, and gained really no powers other than, to respond to the emergency in a better way with. He could have not declared an emergency, not triggered the double pay provisions, and not given any additional hazard pay. But then it would have been totally subject to an arbitrator, some third party deciding, was COVID-19 truly an emergency situation? And if they did, we'd then be liable for all that double pay for the entire duration of the pandemic, which frankly would bankrupt the county or significantly, have a massive hundreds of millions of dollar impact. Or what he did, which is try and negotiate a lessened rate of hazard pay that fairly compensated the frontline hardworking employees during the middle of a pandemic while not bankrupting the county long term. And obviously that was the decision that was ultimately made. And so it's just important to understand contextually that the definitions of emergency in this circumstance do not directly apply in county code or in the personnel regulations to a pandemic. And that left us in a very difficult situation in the middle of the response to the pandemic to try and figure out how to navigate the space with what is potentially hundreds of millions of dollars of liability in the balance. And so I think obviously that gives you a little bit of context for what was the discussions that were going on. Obviously I was the emergency manager at that point, focused on other things. And many of the people on the second floor who were involved in the process for this have now changed over the last 12 to 20 months. And so trying to give you some context, wasn't necessarily privy to all the conversations as the memo was being drafted. It was discussed yesterday and other things, but I think that gives you some sense of what the challenges were that were being faced.
Thank you for that. I appreciate it. I just wanted to understand, just a follow up, the attorney for the 83 non-unionized employees who filed grievances against the county pointed to Elrich's letter to FEMA, which said that the county was in a state of emergency. So I guess there's a bit of confusion, and as you said, an arbitrator can say well, this means this is how the county is defining a state of emergency. I just was wondering, did County Executive Elrich share this letter with the county attorney and the council, and if not, why didn't he not share it with them?
I don't know. I do not believe the letter was shared with the council. The letter in question here was sent. So I think this came up a bit yesterday. Is we were trying to qualify the hazard pay and for FEMA reimbursement. And there are obviously, the offering of hazard pay has to occur during an emergency and has to be part of a previous agreement. And so obviously at the time we were trying to give as much evidence and summary to FEMA as possible to try and qualify the costs as being eligible. And so I think that that was the context for the letter. I don't believe, and again, I wasn't at the meeting. I don't believe it was shared with the council. Now, I think we agree at this point that the process, the letter definitely should have gone to the county attorney. I think that was acknowledged yesterday. I think the county attorney said that yesterday. But at this point in the middle of responding to the pandemic, but we'll set up a call with the county attorney to over some of this as well.
Yeah, I'll just say, we were trying to minimize our exposure. And we were trying to get the FEMA reimbursement, which we believe, based on previous emergencies where we had historically gotten funding from FEMA for being in an emergency. You had the governor who had declared a state of emergency in Maryland, so it was hard to argue that we weren't in a state of emergency, whether it was called by the county executive or called by the governor. The governor didn't distinguish which parts of Maryland were under an emergency. So our goal was to try to protect the county and try to get FEMA to treat us as they had it during other emergencies. It didn't, frankly, that was the direct focus we were doing. We would have assumed that the council would have wanted us to try to convince FEMA that we were working in a state of emergency, because that would have triggered more payments from them and liberated us from having to pay for some of this. So it seemed like the best decision for everybody's benefit. Like I said, I can't imagine anybody saying, don't ask FEMA for emergency reimbursement, because that would have only put a bigger load on us.
Sorry, and final question, the Maryland Board of Education today is going to be meeting to discuss the mask mandate and whether to repeal it immediately today or wait until February. Just wondering, that doesn't have any effect on the county, correct? Because the county still has an indoor mask mandate in place?
That's correct.
Yep,
that's correct. And also, just to be clear, even when we didn't have an indoor mask mandate at the time, the local Board of Education, I believe, and MCPS decided unilaterally, not unilaterally, but they decided themselves to enact their own mask ordinance. And frankly, I would expect that would stay in place at the local level. I don't have any reason to believe it would be removed, even if we didn't have a mask mandate at a county level. I think the school system themselves had already put one in, and I think that would remain in effect even absent the county having gone on and off or for the local ordinance.
Okay, you're good. Thank you, Dominique. Next up, it's Kate Ryan, WTOP. Good afternoon, Kate.
Struggling with that mute button. Thank you very much. I wanted to understand one thing, Mr. Elrich. Why not, though, share the letter on the hazard pay with the county attorney? I'm assuming that's an SOP, a standard operating procedure. And then quickly, I have another.
I didn't make a decision not to share it. I thought it was going through whatever normal processes we had, and so nobody sat here and said, don't share this with the attorney.
But normally things would cross the attorney's desk and it just didn't in this case?
That may be the case. I can't speak for who made the decision not to send it there. Frankly, I don't understand it either, but I don't sit there and, tell people who to send every copy of every letter to. This case, I assume that it had gone to everybody it needed to go to.
Got it. Okay. And then on, I know there are a lot of unanswered questions about Omicron. There's so much, even how to pronounce the thing was a debate here in this newsroom. But I am curious in terms of testing and what it does to the need for people to test. I know all along you all have said, look, along with getting vaccinated, get yourself tested, keep up to date with your test status. Seems like a smart idea. the state had forwarded 500,000 tests to the counties. I'm wondering, A, how many of those tests did we end up getting? And B, does Omicron, or will it require a different type of test?
It's okay, I'll start. So currently the PCR test is being used to sequence any specimens, as they've done before at the state labs and at Johns Hopkins and the University of Maryland in Baltimore and other labs that Maryland has contracted with. It has been the type of test that's used to detect Delta in the state and in the county. There's been no updates regarding whether or not other tests, such as a rapid test or an antigen test, is able to detect the lineage, the B11529, which, if that makes it simple rather than saying Omicron. But so that's pretty much the guidance that we have received to date. And again, it's Wednesday. I have a call this afternoon with the Maryland Department of Health and the other health officers just to see if there are any updates. But right now, the PCR test, which was used to identify the Omicron strain of the variant. So that's pretty much the test we reuse. Folks are getting tested about 4,500 to 5,000 a week. And so we encourage all in the county, if they have traveled, especially if they've traveled abroad, to get tested and to know their status as they've been done. They've been very diligent in getting tested, and we continue folks to get tested. Now, regarding the rapid test, I will turn that over to Dr. Stoddard. We talked about a plan, but I'll let him share some of the planning that we've done with the rapid tests that we received today.
Yeah, I want to talk a little bit about the first question a bit more too. So first off, the rapid tests appear all to work with Omicron. I think that has been, there's been, in Europe, they've shown someone who tested positive for Omicron, they ran different models of rapid tests and they all came back showing positive results. And so there's no reason to doubt the rapid test. Now, the interesting thing about PCR testing is that there are mutations in Omicron that make it make one of the PCR, basically PCR runs specific sequences against the sequence in the virus. And two of the three that are commonly used to diagnose COVID-19 come back as positive and showing a result. One actually comes back as not showing a result. So you're actually able, via just running the samples, to distinguish Omicron from Delta, because Delta will show 3 different distinct lines. Omicron will only show 2 distinct lines. And so actually you can kind of screen at a more gross high level for the presence of Omicron in sequencing. The important thing about that, and transitioning to the question about whether people should continue to get tested, the samples that are being sequenced are the ones for which we have PCR samples collected. And so if people come in and get tested for COVID-19, some of those people presumably will test positive. And then those are the samples that go to the state laboratory for potential sequencing. And so our ability to detect Omicron in Maryland and in Montgomery County is largely incumbent upon people coming in to get tested at a regular routine basis. And so that's a key part of this. Now on to the rapid test part. As you discussed, 500,000, not all 500,000 have been distributed. I think they're going to be doled out over time from the state. We've received just about 10,000. We've used about 1,000 of them so far through other giving them out through some of our test sites, or using them to supplement what we had at test sites. But what we're going to be doing is a series of things that we talked about a little bit in the county executive's opening comments, and that is we're going to target our we want to focus the rapid test kits on people who are at disproportionate risk for contracting COVID-19, not just because they're at that higher risk, because they're also the people who are likely going to transmit COVID-19 in certain settings if they do become infected and don't know their status. So for example, frontline workers, restaurant workers, construction workers, people who are working in the field, our contact tracing data says they're still at the highest risk of contracting COVID-19, and therefore breaking those chains of transmission is key to reducing the total numbers in our community across the board. And so we'll be working through our minority health initiatives, our community groups, to distribute to people who are disproportionately frontline workers, who are also tend to be disproportionately Black and brown, as well as through our frontline worker associations like Restaurant Association, construction groups. We'll move into retailers and the like. Now, I know some other jurisdictions have done library-based distributions. We're looking at that for the future, but this initial amount that we've gotten from the state, we certainly want to get in a more targeted fashion to people who are at higher risk of contracting COVID-19. That's those first groups we talked about.
Thank you very much. I appreciate it.
Thank you, Kate. Next up, it's Steve Bonell, Bethesda Beat. Good afternoon, Steve.
Good afternoon. More question on Omicron. I know you said that, we don't know a lot yet, but I'll give you something specific to respond to. So something I saw, I think it was a South African scientist, said that it's more contagious than other variants, but we're not seeing as many serious cases. What are you seeing in the literature about, I guess, that specific kind of claim, I guess?
I mean, it's just that it's highly transmissible. I've seen some data in the literature saying that it's more adapted or mutated to cling to, or the protein spikes cling to the cells in the lungs. But again, the test sample is different and it has varied. And so we're looking at more sequencing, as the county executive indicated, over the next 100 days. But hopefully before then, we will see more data and literature about the actual variant. Hopefully there are no sublineages to the Omicron variant, as scientists around the world and in the United States continue to assess the impact, the transmission, transmissibility, and all of those things that we read starting on Friday when we got the announcement. I know Dr. Stoddard and I had conversations and shared literature and scientific data about the emergent variant as reported by the World Health Organization, and prior to receiving any updates from the CDC or the Maryland Department of Health. So we will continue to assess and have our epi team, look at any trends, any emergent trends that may impact the outcomes in our community.
Yeah, and Steve, I would just say that there's the literature right now is very interesting to try and read, because everyone's trying to draw some greater conclusion from very limited data sets. And I would caution against us doing that. That is to say, I've read the reports from the South African doctor that, where I think she was quoted, and I think she later said she was quoted out of context, where she was talking about some of her younger patient groups. I've seen different news articles suggest that there has been an increase in hospitalization in South Africa, and that the trend looks exactly like it would under other variants as they're emerging or as they're transmitting more capably. So I think it's just too early to say. I mean, there's no selective pressure on viruses to be more or less virulent, meaning the virus doesn't really care if it makes someone super sick and or kills them. It cares so long as the real benefit is if it can transmit effectively prior to or while that's happening. Meaning if a virus can transmit to 10 people from a super sick person, it's not going to feel better if it can only transmit to 5 people from a less sick person, right? So it really comes down to what viruses are selected for are those viruses that can transmit and evade immune systems most effectively. That's where the selective pressure is on virus. It really is not on its virulence so much. It's just typically when someone's super sick, they're not a great transmitter, but that isn't always the case as well. So I think we would be cautious to not assign anything positively or negatively to Omicron. The mutations suggest immune evasion, suggest maybe some transmissibility differences, but until the scientists who are doing the work have had the opportunity to really run the assays, I would not want to draw any conclusions at this point.
And Steve, I think just to add to Dr. Stoddard's comment, after 22 months, I think we're 12 or 13 Greek alphabets into the sequencing process or the lettering process. And I think those layered prevention measures still are in place. And I think the message, in addition to Omicron and any other subsequent variants that may be identified, is that we still need to use or understand the efficacy of mask wearing, hand washing, physical distancing when we are in settings, indoor spaces with limited ventilation, or in spaces where individuals are outside of our household. When I looked at the CDC's website over the weekend, all 3 days, and even on Monday, none of those layered preventative strategies have changed. And so we still need to be vigilant with those layered protective measures. We're also in flu season, and I looked at the data from our EPI team, and we haven't seen the level of incidents regarding flu transmission or flu cases in the county because folks have worn masks either as a behavior modification or because it's been required. And so we still need to look at those public health practices that have been in place that have kept us safe to the most approximation these past 22 months.
Very detailed. Thank you.
Thank you, Steve. Next question comes from Susan Pollack, Montgomery Community Media. Good afternoon, Susan.
Good afternoon. Thank you. I wanted to find out if there are any plans to increase the county library hours, and if the reason they're reduced is still related to COVID. Right now, 4 nights a week, it closes at 6 and no Sunday hours. And people are saying if they work, it makes it difficult.
We'll have to get back to you, Susan. I believe there is a plan for them to be fully reopened, I think around the end of this month, but I would not want to mischaracterize that. So that was my understanding. They were coming. There was a strategy being developed to have them open over the next, few, I think end of the year, or beginning of January, something like that. But I would have to get an update from them, the team that's been working on this more specifically.
Thank you.
All right. I do not see any more questions, requests from members of the media. Reporters, going once, going twice. I think we're done for today. Thank you very much for joining us. We'll see you again soon. Please stay safe. Good afternoon. Thank you, everybody.
Good afternoon all.